Welcome to MLT 101, Human Anatomy. My name is H1 Barnes, and our lesson topic is the endocrine system. The word endocrine comes from the Greek words endon, which means within, and crinin, which means to secrete. Your endocrine system consists of a group of ductless glands, referred to as endocrine glands, which secrete substances called hormones directly into your bloodstream. Hormones are powerful chemicals that can have a profound effect on your body. They can alter and affect things such as your metabolism, growth and development, reproduction, the ability of your body to react to stress or resist disease. They can even change your personality. Your endocrine system structures include various hormone-secreting glands and other organs and structures which have endocrine function. Your pituitary gland is often referred to as the master gland of your endocrine system. This is because it secretes hormones which stimulate the other glands. It tells the other glands what to do. The release of hormones by the pituitary is actually controlled by chemicals called releasing hormones, which are sent from the hypothalamus of the brain. The hypothalamus is like that corporate executive officer, which tells the middle manager, your pituitary gland, what needs to get done. The pituitary gland then sends signals to the individual glands that are like the different departments in a facility or in a factory that actually do the jobs. Your pituitary gland produces the hormones adrenocorticotropic hormone, ACTH, antidiuretic hormone, ADH, follicle stimulating hormone, FSH, growth hormone, GH, and thyroid stimulating hormone, TSH. Your adrenocorticotropic hormone stimulates your adrenal glands. Your antidiuretic hormone decreases urine production. Follicle stimulating hormone stimulates development of ova and sperm and the secretion of reproductive hormones. Growth hormone is going to regulate the growth of the body. Thyroid stimulating hormone will control the thyroid activity. You have another gland in the brain posterior to the pituitary referred to as the pineal gland. Your pineal gland produces and releases melatonin. It's going to help set your circadian rhythm. That way you're awake during the day and you're asleep at night. Fun fact about the pineal gland, as people age, some of the contents of that gland can calcify and become like a sand-like material. This is referred to as brain sand. It's sometimes considered to be a suspect cause of why the elderly can frequently have difficulty sleeping or can't sleep for a long period of time in the evening. Why a lot of old folks will go to bed late, sleep for 4 hours, and then wake up early in the morning. The thyroid gland is located in the throat, near the larynx. It releases calcitonin, triiodothyronine, which will be referred to from here on out as T3, and thyroxine, which will be called T4. Your calcitonin lowers the level of calcium in your blood. Your T3 will increase your metabolic rate, and T4 will also increase the metabolic rate. The parathyroid glands, and that is glands with an S, plural, are located in the throat behind your thyroid. You have 2 on each side, 2 on the left side, 2 on the right side. They produce parathyroid hormone, referred to as PTH, which regulates the calcium exchange between blood and bones. It also increases blood calcium levels. Your thymus is located in your chest, behind the breastbone, behind the sternum. It produces a hormone called thymosin, which promotes the maturation of a type of white blood cell called a T cell, a T lymphocyte. Those are involved in the development of your immunity against infection. Your adrenal glands are located on top of your kidneys. You have 1 adrenal gland on top of each kidney. They produce epinephrine, also known as adrenaline, norepinephrine, also known as noradrenaline, cortisol, commonly referred to as the stress hormone, and aldosterone. Epinephrine increases your blood pressure, heart rate, metabolism, and the release of glucose. Norepinephrine does the same. Cortisol is active during stress, and it aids the metabolism of carbohydrates, proteins, and fats. Aldosterone plays a role in the regulation of sodium. The islets of Langerhans are located in your pancreas. They release insulin and they release glucagon. Insulin assists in the process of moving glucose from your blood into your cells. The release of insulin causes a direct release in a person's blood sugar levels. It doesn't change how much sugar is physically in someone's body. It causes that sugar to move from the bloodstream into the cells. Glucagon increases blood glucose levels by stimulating the liver to release glucose into the bloodstream. To do that, it has to break down a storage form of glucose referred to as glycogen from that storage form into the usable form called glucose. For men, the testes are located in the scrotum and produce testosterone. They stimulate the growth and functioning of the male reproductive system and the development of male sexual characteristics. For women, the ovaries are located in the pelvic cavity. These produce estrogens and progesterone. Estrogens stimulate the growth and functioning of the female reproductive system and development of female sexual characteristics. Progesterone prepares the body for pregnancy.